Okay, so you're gonna give me a cue? Ok, bonsoir. Nous avons ce soir avec nous Dr. Michael Rakin. On va faire l'interview en anglais parce qu'il parle un peu le français, mais surtout l'anglais. Et nous allons parler d'un sujet qui est de plus en plus courant, et c'est le sujet donc un peu de la chirurgie du laser. Donc, je vais vous présenter un docteur américain, Michael Rakin. Michael, it's a pleasure to have you with us tonight.
Well, thank you very much.
I heard you say a few words when I was in your office in French, but I'm doing it in English so that everybody, maybe you'll feel more comfortable.
Definitely. Okay. My French is limited.
Right, okay. So you learned maybe a few years French when you were young?
I did. I studied French in school for about 6 years.
Oh, that's a lot. But you didn't practice the conversation part, maybe?
Unfortunately, I didn't, no.
Okay. Because she was, the previous guest, she was she was like giving conversational French, and she married the man who she was teaching. You heard that part. I don't know if you arrived when she was saying that. But anyway, you probably have the opportunity to practice it in the future, maybe if you travel to France. Have you been to France, by the way?
I have.
Oh, really?
I've been in Paris primarily,
great.
But I've traveled through the country just very quickly.
How did you like it?
Oh, very much.
You did?
Very much.
Okay. Well, I'm glad to hear that. I mean, some Americans think it's too expensive, the food and all that, and it's true. It's a little bit more expensive than here to live, but all things being equal, you get better quality, and everything compensates for what you're missing. So what we're going to do then, I don't know what subject you want to talk about, but I primarily invited you to talk about that new technology of the laser, since it's your specialty, I suppose.
Yes.
You probably have other specialties also.
Well, my practice now is primarily cosmetic laser surgery.
Okay. So I saw a show on laser surgery on Channel 11, which is the Spanish channel. Mm-hmm. And then I saw something on CNN. So it looks like that subject is pretty much being covered in several media because it seems that it's something new and people want to know more about it.
It is. It's a new technology, and it is really literally the state of the art now in cosmetic surgery. Mm-hmm. There has been tremendous public interest and awareness of this now, and people are constantly trying to find more out about it.
Yeah, so I'm glad that maybe the French community, when they tune in, they'll think maybe they'll listen to French, but at least they'll learn about the subject that might enlighten them and let them know what's happening. So basically, the surgery, it's called surgery, but it's not a surgery. I mean, it's not really, you don't cut, right?
There's no cutting with lasers per se. There is, in a sense, a type of cutting in that lasers vaporize tissue. They basically heat cells up, or the water within cells, to the boiling point to 100 degrees centigrade. Because cells are primarily water, or predominantly water, the water evaporates. It goes into steam, it vaporizes, and then the remaining solid portion of the cell similarly goes up in the mist or the steam, what we term vapor or laser plume.
I see. And that process, is there a reason why they call it surgery? I mean, it's not really surgery, right? I mean, it's more like a procedure. I mean,
it is a procedure, but to the extent that you invade tissues, you could call it surgery.
Oh, that's why. Okay, now it makes a little bit more sense. Okay, so actually, what is really reassuring about it is that there is no trauma. There is no blood involved, and there's no cutting, and it's a little bit more clean, kind of.
Absolutely.
Right.
With the particular laser that I use most commonly, which is a carbon dioxide laser, blood vessels are sealed. So literally, they become, the procedures we do are bloodless procedures.
Great. Okay.
Nerve endings are similarly sealed, as are lymphatics, the clear vessels that carry away body fluids. So when procedures are done with a carbon dioxide laser, not only do we see virtually no bleeding, we have very little discomfort afterwards, and much less swelling than one would traditionally have with other surgical techniques that have been employed in the past.
That's true. And also maybe less bruising.
Oh, that's absolutely.
None.
Yeah,
none.
Usually none, but on occasion we can see some bruising that's associated with the injection of anesthetics.
I see, okay. So if you compare, let's say, what you call laser procedure or surgery to other kinds, how effective are they? Are they? Is one more effective than the other? Is one better than the other? I mean, how can you compare them both?
I think you really have to look at the different types of procedures that are being done and compare those individually. My practice is primarily skin resurfacing, that is the restoration of elasticity of the skin, the elimination of wrinkles and folds in the skin, and also cosmetic eyelid surgery.
Right.
If we look at skin resurfacing, the traditional types of skin resurfacing had been done in the past with either chemical peeling, where chemical agents are used to burn the surface layers of the skin and allow them to peel off over a period of days and then replace themselves, or with dermabrasion, where a mechanical device was used to remove the surface layers of the skin, almost like an abrasive would, and then allow that to heal.
Okay.
It's a very different technique when we resurface or regenerate and rejuvenate the surface layers of the skin with a carbon dioxide laser. Firstly, it's much less traumatic, as you pointed out before. There's very little, if any, bleeding. There's no bruising. We don't see scabbing. We don't see crusting or significant amounts of discharge as we did with the more traumatic procedures.
Before, okay.
And there's just much less inflammation as a result.
Okay, and those 2 layers of skin that you say that are evaporating, do they regrow?
Yes. They basically regenerate themselves within a period of 7 to 10 days. The whole concept of resurfacing the skin is to remove the top 2 layers of the 3 layers of the skin, what is known as the epidermis and the papillary dermis. If those 2 layers are removed, they will regenerate within 7 to 10 days. And when they do, the cellular characteristics or the microscopic characteristics of the new skin, which regenerates to replace it, is much more youthful. So the skin is more elastic because there is a greater amount of elastic protein.
I see.
And in addition, the collagen, the structural protein of the skin, is more youthful in its appearance. So the skin is actually firmer.
Oh, okay. Okay, so basically, we talked about other procedures that allows you to remove a layer or 2, like retin-A, whatever, and or like I mentioned last time I saw you, the sunburn. I mean, how can you compare you removing the 2 layers of skin that way or the 2 layers of skin the other ways? Can you explain?
Well, I think probably what is the greatest advantage of doing it with a carbon dioxide laser is the precision. The one thing we always worried about when doing chemical peels or doing dermabrasion was the fact that we could not titrate or control the depth that we removed the surface layers of the skin very precisely. When we applied chemical agents to the skin, they would burn the skin to a particular depth. But the skin thickness changes over the different portions of the face. And so if you were applying the same strength or amount of acid on very thin skin, such as the eyelids, and then onto much thicker skin as around the lips, you would ineffectively remove the surface layers around the lids, but maybe more effectively remove it around the lips. The problem would run in if you would remove too deep a layer, you could stimulate the formation of scars. Well, with a CO2 or carbon dioxide laser, we have incredible precision because we can literally visualize every layer of the skin as it's removed.
Oh, on the microscope or on something?
Under surgical telescopes. It is a microsurgical procedure.
Oh, so you can see exactly what you're doing.
You can.
I see.
And you can also adjust the laser very precisely so that the amount of energy that is delivered with each pulse of the laser will
Can
vaporize.
be adjusted to the person?
Exactly, and to different portions of the face.
I see.
And because there's no bleeding whatsoever, we perfectly see what we're doing. So we've lessened any risks associated with complications such as scar formation.
Oh, okay. So there's like an advantage, and it makes it maybe less painful and everything. I mean, everything considered, it's better procedure.
Absolutely. Safer, less painful, faster recovery, and much better and improved results.
I noticed, I don't know, when I walked in your office, there's a lot of women, maybe 1 or 2 men once in a while. Are women have a tendency to age faster than men, first of all? Is that a fact?
No.
Or is it,
I think the aging is primarily determined by genetics and lifestyle. Men and women probably age at a fairly similar rate, given similar genetics and similar lifestyles and lifestyle habits.
Oh, okay. So women are just more concerned about their looks.
I think in general women are, and I think women tend to be much more open about being concerned about cosmetics and appearance.
Okay.
And so they are more forward, I believe, in going ahead with cosmetic procedures.
Okay.
Certainly the fastest growing area of cosmetic surgery now is in men. So
a lot of men come see you?
It's changing. We're seeing an increasing percentage of our patient population being men. And I think it's just becoming more open in society for men to feel comfortable about doing cosmetic procedures.
That's true. It's same as with dyeing your hair. I think for women it's acceptable, but for men it's just like, ooh, it looks a little bit strange that you dye your hair. But it's more accepted now. I mean, but it looks better, I don't know, as a man, what's your opinion, but it looks better on a woman than a man, for some reason. It's just psychological.
I think it's true, and I think it probably has to do with society values.
Yeah.
Very often, as you can see, my hair is fairly gray.
So you're not concerned about it?
No, and it's surprising how often I'll make a comment to someone about the fact my hair is continuing to gray, and yet people will say, oh, no, it looks very distinguished, it looks good. Yet a woman my age would be very unhappy, I think, with the amount of gray hair I have.
So a man is more accepted for men.
So.
It's
I think so.
So but also for the looks, a woman has to kind of always kind of compete in the world with her looks a little bit more, maybe? I don't know.
I think that's true.
Oh, okay. Because maybe her appearance is more important, I don't know. But all things, I don't know, you have done several surgery, I think about 5,000 you said? About.
I've done well over 15,000 surgical procedures.
Oh wow, yeah, you must be very, very busy. Can you tell us, for example, I mean you have a lot of experience, can you tell us, for example, the difference between the surgery into a black person or a Chinese person or white person? What kind of results you're getting from different races?
Well, I think with the skin resurfacing, the removal of wrinkles and the rejuvenation of the skin, there are definitely different concerns depending on the color of the skin. The darker a person's skin in general, the more reactive it is to any type of trauma or procedure. So when we do resurfacing on someone who has very dark skin, we have to be concerned to suppress the pigment production within the skin so that we do not see the excessive production of pigment after we do the resurfacing. We're able to accomplish that with creams that are applied to the skin that interfere with the production of melanin, the pigment within the skin.
I see.
And that works very effectively. Also, after the procedures, we have to be very diligent about the use of sunblocks because the ultraviolet light from the sun will stimulate the production of pigment. We see the same thing in Asian individuals. Asians have very, very reactive skin, even though their skin is not terribly dark. Hispanics or African Americans or Africans in general have very reactive skin as well, but it's more darkly pigmented. But Asians
for example, someone has like a black skin, if they do the surgery, then they'll have a white skin and a black?
No, where the surgery is performed, if the pigment is not dealt with, will become darker than usual.
Ah, okay.
Darker than normal.
Okay.
But if the pigment is suppressed prior to the resurfacing and then is allowed to heal, the color will return entirely to normal.
Same.
Exactly the same.
Okay, so there won't be like patches on the face of the person?
Not with proper care.
I see. Because there was a concern because I would assume after I finished what I did is that maybe the solution would be to just do the whole thing. I mean, just to avoid any problem with these kind of things that could happen later. I mean, with the difference of colors and maybe just go ahead and do the whole area. I mean,
doing a resurfacing on the entire facial skin is always the best way to go.
I think so too.
You know, there is a period of time, as you know, after the resurfacing where the skin is somewhat pink or red.
Right.
And even though that gradually fades back to an entirely normal tone, if one resurfaces the entire face, then it's all even in its tone, even though it's perhaps a little bit pink or red. And that's not terribly noticeable, so an individual can go without any cover-up or concealer or makeup early on and look just fine and really quite normal.
Yeah, that's good. We hear about the laser, like I told you, in several TV channels. What are because I thought there was other applications for the laser. Yours, of course, is the removal of wrinkles and all that. Can you give us maybe, I'm sure you studied it when you were in school, the different areas where lasers are being used?
Sure. Lasers are being used extensively in all areas of medicine, certainly in ophthalmology or eye disease or eye surgery. We use lasers for the removal of cataracts, for the vaporization of cloudy membranes that develop in the eye.
Yeah, I heard about that, yeah.
Treating diabetes, retinal detachments, treating glaucoma, many of the diseases that affect the eye.
Always in the eyes, okay.
Always on the eye. Certainly on the skin, we use them not only for wrinkle removal and cosmetic lid surgery, but we use them for the removal of tattoos, for the treatment of skin cancers, for the treatment of growths on the skin, such as warts, skin tags, melanomas.
Also medical problems. I
see.
Yes. And you treat those too? For example, if someone comes to you and say, I have a growth here, you would treat that?
I can. Certainly, I've more or less limited my practice to the face.
To the surgery, I mean to the cosmetic part.
Correct.
I see. So you don't deal too much with the disease
Not much any longer.
I see. Okay.
My practice is primarily cosmetic.
Okay. So, but you can combine the two also. I mean, if somebody has like a piece of skin cancer, you can remove it at the same time.
That's correct.
Okay.
And very often when people will come to my office for skin resurfacing to remove wrinkles, they may have growths on their face, little moles or freckles, things like that.
And might go away too.
I can vaporize those at the same time and remove them.
Okay, for example, last week I had a guest and she had a perfectly youthful face. And I mean, she was exactly my age, she was 44, but she was Asian, but her neck was all wrinkled. Is there anything that can be done for the neck?
Well, there are certainly a number of different things that can be done. Light chemical peels can be very effective. In addition, surgery on the neck, what we call neck lifts, works well. Liposuction of the neck in some individuals can be very beneficial in terms of rejuvenating the neck. And there are some individuals who are experimenting with carbon dioxide lasers to resurface the skin on the neck as well.
I see.
It's a little controversial because the neck is different in terms of its quality of skin and its cellular makeup. There are many fewer oil-producing glands, sweat glands, and hair follicles on the neck. And it's from those structures that the new surface layers of the skin regenerate. So there is delayed healing on the neck when we do a laser resurfacing. And as such, it
takes a long time.
And it's much riskier.
Oh, okay. And the person has to take a lot of time off from work than the face, for example.
That, number one, and there's a much higher risk of scarring.
Oh.
So even though there are colleagues of mine who have been doing laser resurfacing of the neck, they've had very limited experience, and that is certainly investigational at best.
So you'd rather not do it?
I'm not doing it currently.
You're afraid of lawsuits?
Well, I think there's significant potential problems. I would prefer at this point in time to wait to see what other people have experienced with a greater number of individuals, perhaps in states where there's less litigation.
Because I noticed the lady who does the CNN show, Moneyline, she has a perfectly youthful face because you can tell she had done maybe plastic surgery, but you can tell her age by her neck.
Yes.
And she's always wearing like a neck, sweaters with turtlenecks. And I say, wow, she can afford this beauty on her face. Why can't she afford the neck? Because maybe it's not there yet. I mean, the procedure is not available yet.
Well, there are good procedures. There are good surgical procedures that will rejuvenate the neck.
Okay, but it's not as effective maybe for the face. I mean, maybe the results are not as effective or some reason. Sometimes you can tell the age by the neck, and because you can tell they've done their face.
In incomplete plastic surgery.
Yeah, I think in any thing you should do the whole thing, or else you can tell.
Right, it's very true.
I mean, it's okay to look youthful, but if you give it away by other ways, then it's like you didn't do it.
Right.
But so you yourself have done a lot of men also.
Yes, probably 30 to 40% of my practice is men.
Okay, and how does that work? Maybe because men grow beard, right?
Yes, actually their skin heals faster as a result because they have much greater amounts of facial hair and hair follicles.
Oh,
So the healing process is a little bit more rapid. Men's skin is also thicker on the face,
right.
and so they tend to lose the redness at a faster pace than women do. They remain red for a shorter period of time.
Really?
Mm-hmm.
Okay, but I think if you keep a beard like you, your hair, your face will remain youthful because the hair will protect your skin.
That's very true. And for example, when I shave my beard off, which I've done intermittently over the years, the quality of the skin beneath the beard is much better than the skin.
One that doesn't have?
That's right.
What I thought. So, for example, I see a lot of men who, because they shave every day, they develop what they call the thing that falls off here. Under the chin. I don't know what is this area called, like the
neck.
The neck? Okay, so it's below, under the chin.
Yes.
And that kind of falls because you shave, and it damages the skin, correct?
Well, it can. It certainly can.
Or it makes it fall out.
Well, really two things can happen from shaving. Shaving can be very beneficial because if someone shaves closely, it actually removes on a continuous basis the surface layers of the skin.
I see.
And that can keep the skin turning over or regenerating. And when it does, it stays healthier.
I see.
And that's really why things like retin A or glycolic acids are helpful and beneficial because they cause the skin to exfoliate.
I see. Okay, so as you shave, you also remove a little bit of skin sometimes?
Very frequently.
I see. Okay. So it's not then by to protect your skin that you let your beard grow then?
No.
No. It's
style and fashion.
Oh, okay. It gives you style. Okay, I was wondering if there was a secret you were trying to hide from us.
No.
Okay.
Good sunblock also will work nicely.
You do use it?
I try to use sunblock whenever I'm out of doors.
But you are very tanned, so I thought maybe you don't use it.
I just came back from a week in
Hawaii?
on vacation. No,
Oh.
I was actually, believe it or not, in Michigan.
Oh, okay. And it was sunny.
It was every day.
Okay, great. So you are kind of rejuvenated and rested, and how do you let people know that? I know, of course, you do advertising, but a lot of people are now more and more aware that this procedure exists, and it's because it's on the news all the time.
Yes, and I'm very actively involved in giving educational seminars to the public, and so I try to really share with people what is out there in terms of the technology and techniques that we have available to keep us looking good and staying healthy.
All right, so it looks like we have covered the subject. Maybe one last question. Are there any side effects? Can it, like X-rays might give you cancer if you do it too often? Is there any side effect?
No, the radiation is just light. It's very safe.
Okay.
It's technology that's been around for a long time, but now being applied onto the skin, and our track record has been that it is very, very safe with
There's no side effect?
No side effects known to anyone.
Oh, okay. So this has been tested for a while before they put it on the market?
It has, yes.
I see. They wanted to see if people would have developed any cancer after it or something like that?
Yes, and this area of radiation, this infrared light, which is what carbon dioxide lasers produce, is not harmful to human beings or any kind of life forms.
Because, like I mentioned last time, the sun rays, you said damages the skin.
Correct.
But it makes it peel also. How can you explain that? I mean, it does rejuvenate it in a way too.
Well, it creates an inflammation in the skin if we absorb too much light, or it can actually, if you absorb too much, absolutely damage the skin and burn it, an intense sunburn.
I see.
And so when the skin is damaged in that fashion, the surface layers actually die, and then they peel.
And then a new one will grow.
And then it's replaced, correct. The real damage that we have to be concerned about from ultraviolet light is
the third layer, maybe?
That's correct. When it's absorbed by the pigment-producing cells, that can lead to the production of melanomas, a form of cancer.
Oh, okay.
Also, deep damage in the skin can lead to other skin cancers, such as what we call basal cell carcinomas or squamous cell carcinomas.
And that happened to people who have very thin skin, I assume?
Usually very fair people or individuals who have had a lot of sun exposure over many years.
Okay. And suppose a person comes to you and do it, and I know like people say plastic surgery, they need it like every 5 or 10 years. Or how much this lasts? Like you need to do it every 10 years?
Well, it depends on the individual's genetics and lifestyle, as I alluded to before. If your skin does not age very rapidly, this will probably have an effect that lasts anywhere from 8 to 10 years
8 to 10, okay.
in terms of the restoration of elasticity. If you're from a family where the skin is very fair and you tend to wrinkle very easily or very early, perhaps a little bit less.
Okay, so, but there is no problem redoing it?
No, it can be repeated literally after 4 months.
Really?
Yes.
Oh, okay.
Oh, yes.
So you have continuous business in 10 years, right?
Well,
I mean, you're going to have repeat business for sure.
I think that is a possibility, definitely.
Okay, I got it. Okay, so thank you for telling us about all this. It seems like it's good. It's good. It helps. It makes people feel better, maybe.
Very exciting technology.
Okay, so thank you for being here. And by the way, just to conclude, what is the laser? Is it an instrument?
It is.
It's like a pen, right?
It's like a pen. Actually, the delivery system, not where the light is produced, but where it's actually delivered, is like a pen that is held in my hand.
Right.
And I'm able to apply it onto the skin.
Okay, and directly on the skin.
Directly on the skin.
Directly on the skin. You don't put something first.
No, just directly on the skin.
And then vaporizes it, like you said.
Exactly.
Great. So this was Michael Rakin.
Yes.
He's in San Francisco and also sometime in Los Angeles, I understand.
Correct.
And he's here. If you need to see him, he can give you more information. Maybe I missed something. So I thank you very much for being here, and thank you very much.
Well, thank you so much. It's been a pleasure.
Thank you.